So you've done a great job of outlining, several different situations or conditions that you have seen virtually. Can you go a little bit deeper into all the different chronic, acute, all the different types of conditions that you work with on a day-to-day basis, or maybe not a day-to-day basis? Just give us a little insight into that.
Yeah. You think about your students with diabetes, so type 1 diabetes, which is on the increase in the United States here. And it's interesting, we have increasing technology to take care of our students, which is so great.
Yeah.
So we have continuous glucose monitors, we have insulin pumps, but you still need a critical thinker to help guide the school staff through this really process of diabetes and taking care of these children.
Yeah.
And so some of our students start so young. We have a couple of kids that will now be becoming fourth graders, but we started taking care of them when they were 3. So these are our 3-year-olds with type 1 diabetes.
Wow.
In a school that didn't have a nurse. And so now they've had the same nurse for 7 years. There's been a partnership that's developed with the school staff, with the kids, of course. Jennifer is their nurse, and with the parents. And the parents were actually thinking they might want to change schools, but kept their children there because they said, no, Nurse Jennifer is what we need. And so that's an issue. And so diabetes, when you go low, it's a life-threatening condition, really. And so one of the things that we found is what helps that is having a plan. And so we went into some schools that had not had any nurses in the school setting, and they had used glucagon, which is a life-saving medicine that you give when a child goes too low. They had given it 4 times in the previous year. I have not given it in my whole career.
Yeah.
And so we went into the school, set up a plan, trained the staff. What do you do in case of a lows? Coming on us with us for the insulin oversight. No glucagon given the whole year.
Wow.
And this was a large school. It was about 1,000 kids.
Yeah.
And so I think when you think of those chronic care kids, it is true that the treatment is important.
Absolutely.
So coming on, oversight, carb counting with our kids with diabetes. But the other thing that's important is the planning and the training that goes with that. You think about your students with seizures. You think about asthma. All these different chronic conditions. And as we're able to save more, it really starts at birth, right? As we have more and more NIC babies that we're able to save, sometimes there's chronic conditions that come with that. But other times it's just something that happens. But those kids deserve to have the same kind of school setting and school education that every other kid does. And so what the school nurse does is help keep those kids safe at school by making a plan.
Yeah.
And teaching the staff, and then make it so they can come on with us. In fact, we just finished a research study that was funded by Helmsley Charitable Trust and Breakaway T1D. And what we have found is that with the intersection of a school nurse, in this case it was virtually, and we were able to decrease the hemoglobin A1C, which is a monitoring of the blood sugar, the blood glucose, over months by 0.5 point. Which is huge.
Yeah.
And the only intervention was the school nurse.
Wow. That's incredible.
Yeah.
And this, we talk about type 1 all the time because, like you said, it's on the rise. But how do you promote this team at the school to call Avel? Like, how do you make sure, it doesn't have to be this type of situation or a 911 situation. It can be really anything. So how do you kind of help guide them to make sure that even if you just want to talk through something and get the extra level of you're doing everything you're doing right or everything you can in this situation?
Yeah. So really what we teach is we teach the school staff, you can do first aid, but whenever you're wondering, I wonder if that's an assessment.
Yeah.
An assessment piece belongs with the nurse. And so we assign one nurse to every building because one of the things that we've learned over time is you can have a really good school nurse. You have to have someone that is very collaborative and good at developing relationships because the school staff is going to call someone they trust.
Yes.
And so that's really that important piece of what we do is we develop relationships. We keep keep it so it's not like that same nurse can do every single visit for the school, but they have one contact person that they always, that's their person,
Yes.
that they develop their relationships with. And we have a small school that happens to be on a reservation in South Dakota, and our secretary there is probably in her 70s.
Mm-hmm.
And the technology, she can do it.
Yeah.
And she says, I'm willing to do it because I want to talk to Nurse Pat. Because
awesome.
Nurse Pat tells me what I need to do.
Yeah.
And I know this community, I know these families, but Nurse Pat knows the medicine.
That is adorable.
Isn't that great?
That's amazing. Well, and just to think that, technology is not always easy. And so for her to say, like, I want to learn this and be able to do this to help care for the kids here, that's amazing. Mm-hmm. Will you give us, I know it's not visual, but can you kind of talk through how the equipment works and how they on their side, push the button, quote unquote? What does that really mean? And how does that activate an assessment or an encounter on our end of the side?
Yeah, so we really do on-demand nursing care. Mm-hmm. And so what that means is the site gets an iPad, mm-hmm. and then we have kind of a box that is about this big. It has a thing that looks like a doorknob.
Yep.
And with this doorknob, it's called the peripheral device, but with this doorknob, we can take a temperature, and it's all led by the nurse. All the people on site have to do is put their hands up. We push the button. Mm-hmm. We can take a temperature. We can put on a stethoscope piece, which is blue dot to blue dot.
Yep.
Simple.
Yep.
We can listen to the heart and lungs. We show them where they put the stethoscope. We have a derm cam. We can look at a laceration. We can check the pupils when you have a head bump injury. Mm-hmm. I know it's not the favorite thing we love to look at, but you can also look for lice eggs.
No, that is not something we like to look for, but yes, you have to do that.
Yeah, to give guidance to the parents.
Yes.
What are we seeing? Look in the throats, look in the ears. And we train the staff on this, but we started using this equipment about 8 years ago. And the reason we changed to this equipment is because it's called Tidal Care. The reason we changed to it is because of ease of use mm-hmm. for the layperson.
Yeah, so that anybody can use it.
Yeah, and so it's HIPAA compliant. We never put any student information into this tablet, into this system, but it also is not FaceTime. It's an actual assessment that happens. And the amazing thing is, when you listen, it is like I'm here with you and I put the stethoscope on your chest.
Yeah.
And sometimes when you're done with an intense visit and you turn the camera off, you're like, I wasn't there.
Yeah.
Because it is so encompassing and so good.
That's amazing.
It is amazing.
Because I think we've talked to several others, they're like, I always want to jump through the screen. That is part of the thing of like, it took me a second to get comfortable with being like, I can't just jump through in an emergency situation. So to be able to feel like you're still there in this situation is fantastic.
Yeah. One of the things that's been interesting to me about virtual care that has been surprising, I would say, is that when you come on camera, if it's an emergency situation that they're dealing with, or let's say a student that was having a lot of anxiety, was hyperventilating, when I came on camera, I said, okay, you're going to look at me, look in my eyes, and we're going to breathe together.
Yeah.
But it was like I could feel the whole room relax.
Yeah.
Just like when I would walk in the building, if there was emergent, and I would walk in the building, and it was a hyperventilating. It wasn't that this was an emergency situation.
Yeah.
But there is a sigh of relief when you're an educator and you have someone medical either come into your office virtually, just like if you come in physically.
Absolutely. So when someone pushes the button, how fast does that really connect with us on our side? Because, some people are like, gosh, is it going to take 30 minutes like it would waiting for the ambulance? Or how fast is that reaction on our end?
Our average response time is a minute.
That's amazing.
Which is why it really is on demand. And that all-day access is important. So you might not use it for a week. But then when you push the button, the nurse is there.
Yeah.
And I think that's what is the important piece.
Yes.
Because even if you're on site and you have multiple buildings, you're not at your school all the time.
No. Wow. Well, and just to build, like, I'm going back to when you're talking about all these relationships and building those relationships. I think one of the first times I came into the school health hub, talking to one of your nurses, and they're like, I've seen, like you said, this patient since they were little, and now they're graduating, and I got invited to their graduation party.
Yeah.
You just don't hear that. So just hear, you're not seeing random people all the time. You are having the designated 1, 2, 3, however many on our team, but you really build that connection, especially with type 1 diabetic patients and how that helped them through their school journey. And maybe that might have looked different if we weren't there to support them.
Yeah. Well, it means that the kids aren't the ones that are having to make all the decisions about their health care.
Yeah.
Which is a lot for a younger child or for an elementary child, or sometimes when you're in middle school, you just don't want to be different than anybody else when you have T1D.
Yes.
And so it gives kids a break.
Yeah.
So that their brain isn't consumed with helping to take care of the healthcare. They really can learn and be relaxed about those healthcare decisions. That's what the better technology is helping with too.
Absolutely.
But there still are so many decisions that have to be made by people around them when these kids that have diabetes. Yeah. And it's not really just diabetes either. You think about kids that have feeding tubes, that we oversight the feeding tubes. So the kids that have to get feedings at school. We just have a lot of kids that have just little differences.
Yeah, absolutely.
That we help to normalize so that they can have a good school experience.
100%. Well, okay, give me an example, or maybe you have a story too of a school that didn't have Avel and then implemented it. And then what did they start realizing, or what was a surprise to them after, really integrating Avel eCare to their team?
Yeah. Well, I told you about the chronic care or the chronic illness, chronic absenteeism.
Yeah.
Which is a big deal in a school setting that went down. That was one example. But I had an example of a school in South Dakota that had never had a nurse. I think they had about 250 kids. And so we convinced them that they should have us. So as we started, the superintendent told me, she's like, I had no idea a nurse did all these things. I had no idea that we didn't have to take care of our own immunizations, that you would call, you would talk to the parents, you had all the right knowledge. I had no idea. And she said, I have a nurse that lives down the street. And I was like, does she want to work for the school? She was like, she might. I said, well, go find out.
Yeah.
So she hired her. But again, the nurse had never been in a school setting. And so then we were an extender for the next year and trained that nurse. And then the following year, they didn't have a gap. And so we no longer serve the school, which is a success.
Yeah.
It's not like we say that we're the only solution.
Yes.
But we really can fill that gap and can support others so that when the school's like, wow, that's what a nurse does?
Yeah.
Or we have another school in North Dakota that the secretary said, they've had us, I think, 9 years.
Okay.
And they were like, the secretary said, if you cut Avel, I am quitting because I'm not going to do this without them.
Yeah.
But they're long-term relationships.
Yes.